Hello, everyone, and welcome to today's presentation. I'm excited to have you here as we explore the world of medical gas therapies and oxygen delivery systems. The title of our session is Comprehensive Medical Gas Therapies and Oxygen Delivery Systems, with a focus on a variety of innovative and essential techniques. We'll be covering high-flow systems, air entrainment devices, hyperbaric oxygen therapy, and specialized gas treatments. I look forward to guiding you through these topics and sharing some valuable insights. Let's get started. Today, we're going to explore comprehensive medical gas therapies and oxygen delivery systems, which are essential components of respiratory care. This is covered under Chapter 42, and it provides a detailed look at how we administer various medical gases to support patient health. Medical gas therapy involves the use of gases like oxygen, nitrous oxide, and others to treat different conditions, from hypoxia to anesthesia. It's important because these therapies can significantly improve patient outcomes when used correctly. In this chapter, we'll examine the different types of oxygen delivery systems, their mechanisms, and their appropriate applications. Understanding these systems helps us tailor treatments to meet individual patient needs effectively. Throughout this presentation, we'll see how these therapies fit into the overall picture of respiratory management, emphasizing safety, efficacy, and the latest technological advancements. Now, let's move on to Slide 3, which focuses on comprehensive medical gas therapies and oxygen delivery systems, specifically high-flow systems. So, what exactly are high-flow systems? Essentially, they are designed to supply a specific concentration of oxygen, or FiO2, at a flow rate that meets or exceeds the patient's peak inspiratory flow. This means the system can deliver enough oxygen to match the patient's breathing effort, ensuring consistent and reliable oxygenation. These systems are particularly suitable for patients who need a precise FiO2, especially when they have high or variable minute ventilation. For such patients, maintaining a steady oxygen level is critical, and high-flow systems excel at providing that stability. Understanding these systems helps us choose the right oxygen therapy tailored to the individual needs of our patients, which ultimately improves outcomes and safety. Let's take a closer look at comprehensive medical gas therapies and oxygen delivery systems. Starting with high-flow systems, these are designed to deliver a precise and consistent flow of gases. They work by mixing air and oxygen together to achieve a specific FiO2, or fraction of inspired oxygen, which is crucial for meeting the patient's needs. Now, how do we do this mixing? That's where air entrainment devices come into play. These devices blend oxygen with ambient air or use gas blending systems to control the mixture accurately. It's all about ensuring the patient receives the right concentration of oxygen. Two of the most common oxygen delivery systems that utilize air entrainment are the air entrainment mask and the air entrainment nebulizer. The masks are often used in clinical settings to deliver a set FiO2, while nebulizers can deliver oxygen along with medication, also using the air entrainment concept. Understanding these systems is key because they form the backbone of many oxygen therapy approaches, allowing us to tailor treatment precisely to each patient's needs. Let's take a closer look at the mechanism of air entrainment systems. These systems work by directing a high-pressure oxygen source through a small nozzle, which we also call a jet. Surrounding this jet are air entrainment ports that allow air to be mixed in with the oxygen. This setup is crucial because it helps us deliver the right amount of oxygen along with the necessary air mixture, depending on the patient's needs. Now, several factors influence how much air gets entrained at these ports. The first is the size of the port itself. The larger the port, the more air can be drawn in. The second factor is the velocity of the oxygen at the jet. Higher velocity means more air is entrained. Understanding these principles is vital because they directly impact how we control oxygen delivery to our patients. By adjusting port size or oxygen velocity, we can fine-tune the mixture to ensure optimal therapy, making sure the patient gets enough oxygen without overventilating. This interconnected process is a key part of how air entrainment systems function within comprehensive medical gas therapies and oxygen delivery systems. Let's take a closer look at the air entrainment mask, also known as the AEM, or sometimes called a Venturi mask or Ventimask. This device is designed to deliver a precise amount of oxygen by utilizing a principle called air entrainment. Essentially, it mixes oxygen with room air to achieve the desired oxygen concentration. The key to its operation is that it uses a jet orifice or an entrainment port adapter to regulate the FiO2, or fraction of inspired oxygen. By selecting different jet sizes, we can control how much room air is mixed in with the oxygen. Typically, the FiO2 provided by an AEM ranges from about 24% to 50%, making it a versatile option for patients who need controlled oxygen therapy. This device fits into the broader theme of comprehensive medical gas therapies because it offers a precise, adjustable way to deliver oxygen efficiently and safely. Let's take a closer look at comprehensive medical gas therapies and oxygen delivery systems. When comparing different devices, one key aspect is the oxygen velocity. For example, the highest O2 velocity is typically seen with small jets, which means oxygen is delivered rapidly and with a lot of force. This high velocity often results in the greatest entrainment, meaning the device can draw in more ambient air to dilute the oxygen, leading to a lower FiO2. On the other hand, when we look at the air entrainment mask, or AEM, it has the lowest oxygen velocity and the least entrainment. This setup allows for a higher FiO2 because less room air is mixed in, and the oxygen is delivered in a more controlled manner. The larger jet in the AEM also plays a role in this, providing a steady, reliable oxygen flow. Overall, understanding these differences helps us choose the right device for each patient's needs, balancing oxygen concentration, flow rate, and comfort. It's all about tailoring therapy to optimize oxygen delivery efficiently and effectively. Let's take a closer look at the different aspects of comprehensive medical gas therapies and oxygen delivery systems. First, when we talk about the highest oxygen velocity, we're referring to how fast the oxygen jet is moving through the system. This high velocity allows for the greatest entrainment of surrounding air, which means more room air gets mixed in. As a result, this system produces the lowest FiO2, or fraction of inspired oxygen, because the mixture is diluted with more air. The smallest jet is typically associated with these high-velocity systems, like the air entrainment mask, or AEM. Now, on the other end of the spectrum, we have the air entrainment mask, which actually has the lowest oxygen velocity. This means the oxygen flows more slowly, entraining less air compared to high-velocity systems. Because there's less air mixed in, this setup provides the highest FiO2, making it suitable when a higher concentration of oxygen is needed. Interestingly, the air entrainment mask features the largest jet, which helps to deliver that higher oxygen concentration despite the lower velocity. So, in summary, high velocity equals more entrainment but lower FiO2, and low velocity equals less entrainment but higher FiO2. Understanding these differences helps us choose the right system based on the patient's oxygen needs and the clinical situation. Now, let's take a closer look at the air entrainment nebulizer, which is a key component of comprehensive medical gas therapies and oxygen delivery systems. These nebulizers are pneumatically powered and share many features with other aerosol delivery devices. One of their strengths is the ability to provide additional humidification and temperature control, which can be very beneficial for patient comfort and therapy effectiveness. A crucial aspect of these devices is how they adjust the air-to-oxygen ratio. They typically have a fixed orifice, meaning the size of the opening that entrains air doesn't change during operation. Instead, we can modify the air-to-oxygen ratio by changing the size of the entrainment port itself. This allows us to fine-tune the FiO2 delivered to the patient. Speaking of FiO2, these nebulizers can deliver a range from 0.28 all the way up to 1, or 100% oxygen. This flexibility makes them versatile for various clinical needs, whether we're providing low oxygen concentrations or high. Overall, understanding these features helps us optimize oxygen therapy to ensure patient safety and comfort. Now, let's take a closer look at the air entrainment nebulizer, which is a key component in comprehensive medical gas therapies. Pneumatically powered air entrainment nebulizers share many features with AEMs, but they also offer some added capabilities. For instance, they provide enhanced humidification and temperature control, which can be quite beneficial for patient comfort and therapy effectiveness. These nebulizers typically have a fixed orifice, meaning the size of the entrainment port is set. To adjust the air-to-oxygen ratio, we change the size of this entrainment port, which allows us to modify the mixture as needed. Understanding how this adjustment works is important because it directly impacts the FiO2 delivered to the patient. The delivered FiO2 can range from about 0.28 up to 1, giving us a wide spectrum to meet different clinical needs. Overall, these systems offer flexibility and precision in oxygen delivery, making them an important part of our therapeutic toolkit. Let's take a closer look at the air entrainment nebulizer and its features. These nebulizers are pneumatically powered devices that share many characteristics with aerosol-generated devices, or AEMs. What really sets them apart are their additional capabilities, like enhanced humidification and temperature control, which improve patient comfort and therapy effectiveness. Now, a key aspect of these devices is how they adjust the air-to-oxygen ratio. They use a fixed orifice, which means the size of the entrainment port plays a crucial role. By changing the size of this port, we can alter the amount of air mixed with oxygen, effectively controlling the ratio. This leads us to the FiO2 range they can deliver. These nebulizers are quite versatile. They can provide an inspired oxygen fraction from as low as 0.28 up to 1, or 100% oxygen. This wide range makes them suitable for various clinical scenarios, from mild to more severe respiratory needs. Overall, understanding these features helps us select the right device to optimize oxygen delivery and patient care. Let's take a closer look at the air entrainment nebulizer and how it delivers oxygen. When the patient inhales, oxygen is pulled first through the inspiratory side of the circuit, which we can see labeled as point A. This ensures that the patient receives a consistent flow of oxygen during inhalation. Now, if the patient's overall flow demand exceeds the flow provided by the nebulizer itself, the system utilizes a reservoir gas. This is shown as point B, where gas is drawn from the reservoir side. This mechanism is crucial because it maintains a steady oxygen delivery, even when the patient's breathing demands fluctuate. Understanding these flow dynamics helps us optimize oxygen therapy, making sure our patients get the right amount of oxygen efficiently. It's all about ensuring effective delivery while adapting to the patient's breathing needs. Now, let's talk about total flow calculation, which is a key part of understanding how these therapies work. The first step is to calculate the air-to-oxygen ratio, also known as the entrainment ratio. This ratio tells us how much air is mixed with the oxygen to achieve the desired flow. It's important because it determines the overall mixture that the patient receives. Once we have that ratio, the next step is to determine the combined ratio. This simply involves adding the air-to-oxygen ratio to the oxygen itself, giving us a total ratio that reflects the entire mixture. Finally, we multiply this combined ratio by the liter flow, which is the flow rate in liters per minute that the device is set to deliver. This multiplication gives us the total flow output of the device, or in other words, the total amount of gases reaching the patient per minute. Understanding this calculation process helps us ensure accurate delivery of oxygen therapy, which is essential for patient safety and effective treatment. It connects directly to the overall theme of managing and delivering precise medical gas therapies. Now, let's look at how to determine the total flow delivered to a patient when using an aerosol mask. Suppose the flow meter is set at 15 liters per minute and the mask is delivering 80% oxygen. The question is, what is the actual total flow reaching the patient? First, we need to understand that because of the mask's design, the total flow isn't just the flow meter setting. The system adds additional flow to meet the desired oxygen concentration. To calculate this, we use this formula. Take 100 minus the oxygen percentage, divided by the oxygen percentage minus 20. So in this case, it becomes 100 minus 80 divided by 80 minus 20. Simplifying that, we get 20 divided by 60, which equals 0.33 approximately. Next, we multiply this ratio by the flow meter setting, which is 15 LPM. Multiplying 1.3 by 15 gives us roughly 19.5 liters per minute. The key takeaway here is that although the flow meter is set at 15 liters per minute, the total flow reaching the patient on an 80% aerosol mask is actually around 19.5 LPM. This calculation is important because it helps us ensure the patient is receiving the correct total flow for effective and safe therapy. Now, let's move on to slide 15, which covers comprehensive medical gas therapies and oxygen delivery systems, with a particular focus on total flow calculation. When we talk about total flow, we're essentially looking at the combined flow rates of all gases being delivered to the patient. This is a crucial concept because ensuring the right total flow helps us maintain effective oxygenation and patient comfort. Calculating the total flow involves adding up the flows from each individual gas source, whether that's oxygen, air, or other medical gases. It's important to get this right because too low a flow might not meet the patient's needs, while too high could cause discomfort or waste resources. Understanding total flow also ties into the overall theme of optimizing gas therapy, ensuring safety, efficiency, and effectiveness in oxygen delivery systems. So, in practice, always be mindful of the flow rates and how they integrate to provide the best care for your patients. Let's talk about some important aspects of comprehensive medical gas therapies and oxygen delivery systems, specifically focusing on problems related to downstream resistance. One key factor we need to consider is the role of water levels in the circuit. As water accumulates and levels increase within the circuit, it can significantly impact system performance. This increase in water can lead to a reduction in air entrainment. Essentially, the back pressure caused by the excess water decreases the amount of air being entrained into the system, which in turn lowers the total flow output of these devices. It's a chain reaction that can affect the overall efficiency. Now let's discuss the effect of back pressure itself. When there's increased resistance downstream, meaning further along the circuit, this creates back pressure. This back pressure can hinder the flow and alter how well the system functions. Any increase in downstream flow resistance, particularly distal to the point of air entrainment, can actually change how the entire system performs. This is crucial because it can impact the consistency and accuracy of oxygen delivery. One of the most important points to remember is that when less air is entrained due to these resistance issues, the concentration of oxygen delivered actually increases. However, this comes with a trade-off. The total flow of the system decreases. So, you get a higher oxygen concentration, but less overall flow. Understanding these interactions helps us troubleshoot and optimize oxygen therapy, ensuring patients receive the right concentration and flow based on their needs. It highlights how interconnected system components are and why monitoring water levels and downstream resistance is vital for effective therapy. Let's talk about what happens when the entrainment ports of an air entrainment device become obstructed or blocked. This is a situation similar to other issues we've discussed, and it's important to understand because it can significantly affect oxygen therapy. When these ports are blocked, the amount of oxygen delivered actually increases, since less air is mixing with the oxygen. This means the concentration of oxygen in the delivered gas goes up. However, at the same time, the total output flow decreases because the device can't draw in enough air through the blocked ports. This results in a variable FiO2, which can be unpredictable and potentially unsafe. Additionally, the downstream resistance, that is, the resistance in the tubing or airway beyond the device, can become problematic. Increased resistance can make it harder for the patient to breathe comfortably and can affect overall oxygen delivery. So, understanding how these obstructions impact flow and oxygen concentration is crucial for safe and effective therapy. Let's talk about comprehensive medical gas therapies and oxygen delivery systems. When it comes to high-flow nasal cannula, or HFNC, there are a few key components to keep in mind. First, all HFNC systems require a humidifier. This is crucial because it helps keep the patient's airways moist and comfortable during high-flow oxygen therapy. Next, there's the air oxygen blender, which can deliver up to 60 liters per minute. This device allows us to precisely control the blend of air and oxygen, ensuring the patient gets the right FiO2 at high flow rates. It's important to note that all HFNC setups need a gas delivery device that regulates FiO2. This ensures the oxygen concentration is tailored to the patient's needs. Moving on, every HFNC system requires a patient interface, usually in the form of nasal prongs. These prongs are designed to fit comfortably and deliver the heated, humidified gas directly into the patient's nasal passages. Speaking of the gas itself, it's heated and humidified before it reaches the patient. This is delivered through a single lumen circuit, which helps maintain consistent temperature and humidity levels, improving comfort and tolerance during therapy. Finally, there's a variation of the standard nasal cannula used in HFNC. This variation is specially designed to accommodate the high flow rates and humidification requirements, making it more effective for certain clinical scenarios. Overall, these components work together to provide a safe, effective, and comfortable oxygen therapy option, which is an essential part of our respiratory support toolkit. Today, we're focusing on comprehensive medical gas therapies and oxygen delivery systems, with a special emphasis on the high-flow nasal cannula. As many of you know, this device has become increasingly popular in clinical settings due to its ability to deliver high flows of oxygen comfortably and effectively. The high-flow nasal cannula provides heated, humidified oxygen at higher flow rates than traditional oxygen therapy, which helps improve patient comfort and compliance. One of the key benefits is that it can deliver precise FiO2 levels, ensuring the patient gets the right amount of oxygen. It's also great for reducing the work of breathing and providing some level of positive airway pressure, which can be very beneficial in cases of respiratory distress. The versatility and ease of use make it an essential part of our oxygen therapy toolkit. Throughout our presentation, we've seen how important it is to tailor oxygen delivery to each patient's needs. The high-flow nasal cannula is a prime example of an advanced system that aligns with this personalized approach, enhancing patient outcomes and comfort. Let's take a closer look at high-flow nasal cannula, or HFNC, and what makes it such a valuable tool in respiratory support. First, HFNC combines several key features. It delivers high oxygen flow, maintains a fixed flow rate, generates positive airway pressure, and facilitates CO2 washout. Together, these functions make it a very effective therapy for patients with respiratory distress. Now, the CO2 washout aspect is particularly important. By flushing out carbon dioxide from the anatomic dead space, HFNC helps improve overall respiratory efficiency, making each breath more effective. This means patients can breathe more comfortably and with less effort. Next, the positive airway pressure generated by HFNC is also crucial. For every 10 liters per minute of flow, it can produce approximately 1 centimeter of water pressure. This positive pressure helps keep the airways open, which can be especially helpful in conditions like hypoxemic respiratory failure. Another key point is that HFNC acts as a fixed oxygen delivery device. It meets or exceeds the patient's inspiratory flow needs, ensuring they receive a consistent and adequate supply of oxygen throughout their breathing cycle. Lastly, HFNC is capable of delivering a high fraction of inspired oxygen, or FiO2. This high FiO2 delivery guarantees that patients receive enough oxygen to meet their needs, which is vital in managing hypoxia or severe respiratory conditions. Overall, HFNC combines these features to provide comprehensive support, improving oxygenation, reducing work of breathing, and enhancing patient comfort. Let's take a closer look at blending systems for medical gas therapies and oxygen delivery. These systems are specifically designed for situations where we need a high concentration of oxygen and precise flow control. They're particularly useful in complex cases where standard methods might not suffice. One of the key safety features of these systems is the audible warning alarm. If either gas source fails or if there's a drop in pressure, the alarm will sound to alert us immediately, ensuring patient safety. When it comes to control, these systems allow for very precise adjustments of both FiO2, which is the fraction of inspired oxygen, and the total flow output. This level of control is crucial for tailoring therapy to each patient's needs. The main components include separate pressurized air and oxygen sources, which are connected to blenders. These blenders mix the gases to achieve the desired oxygen concentration. We typically consider using blending systems when air entrainment devices aren't capable of providing a high enough oxygen concentration or flow rate. In such cases, blending systems give us the flexibility and control needed to deliver optimal oxygen therapy. Now, let's talk about blending systems, which are a crucial part of medical gas therapies and oxygen delivery. These systems are especially important in situations where we need a high oxygen concentration and flow. They help us deliver the precise mixture of gases that a patient requires. One key safety feature of these blending systems is the audible warning alarm. If either gas source fails or if the pressure drops below a safe level, the alarm sounds to alert us immediately. This helps prevent potential issues and ensures patient safety. When it comes to control, blending systems allow for very precise adjustments. We can control both the FiO2, which is the fraction of inspired oxygen, and the total flow output. This precision is vital for tailoring treatment to each patient's needs. Now, let's look at the components. These systems use separate pressurized air and oxygen sources, which are then mixed in blenders. This setup ensures we get a consistent and accurate gas mixture. Lastly, we use blending systems when air entrainment devices, like simple masks, can't provide a high enough oxygen concentration or flow. In these cases, blending systems give us the flexibility and control needed for optimal patient care. Overall, blending systems are a sophisticated and reliable solution, especially when standard devices fall short of delivering the required oxygen levels. Let's take a look at some other oxygen delivery devices that are commonly used. First, we have bag mask devices. These are self-inflating bags that can provide 100% oxygen directly to the patient. They are quite versatile and are often used in emergency situations or during transport. Next, we have demand flow or pulse dose systems. These systems are pretty innovative because they use a flow sensor and a valve to synchronize oxygen delivery with the patient's inspiration. This means oxygen is only delivered when the patient inhales, which can help conserve oxygen and make the cylinders last longer. Finally, these systems are frequently seen in home care settings. They're designed to be user-friendly and efficient, making them ideal for patients who need ongoing oxygen therapy outside of a hospital environment. Overall, these devices expand our options for delivering oxygen effectively, whether in emergency, clinical, or home care situations, and they complement the broader theme of providing tailored, efficient respiratory support. Let's talk about some other medical gas therapies that go beyond just oxygen treatment. These therapies are quite diverse and have specific uses. For example, nitric oxide is used primarily for pulmonary hypertension, helping to relax blood vessels in the lungs and improve oxygenation. Then there's Heliox, a mixture of helium and oxygen, which is beneficial for reducing airway resistance, especially in obstructive airway conditions like asthma or COPD. Carbon dioxide therapy is another interesting approach. It can stimulate breathing in certain medical situations where a patient's natural drive to breathe needs a boost. Lastly, hydrogen gas is emerging as a potential therapy because of its antioxidant properties, which might help in various conditions by reducing oxidative stress. Overall, these therapies highlight the wide range of options available to tailor treatment to specific patient needs, illustrating the importance of understanding different medical gases in respiratory care. Let's take a closer look at hyperbaric oxygen therapy, or HBO therapy, which is a key component of comprehensive medical gas therapies and oxygen delivery systems. This therapy involves breathing pure oxygen at pressures greater than 1 atmosphere absolute, or 1 ATA, which equals 760 millimeters of mercury. Most treatments are conducted at pressures between 2 and 3 ATA, allowing us to significantly enhance oxygen delivery to tissues. One of the main benefits of HBO therapy is its ability to enhance the host's immune function, helping the body fight infections more effectively. It also plays a crucial role in wound healing by stimulating various physiologic processes. For example, HBO therapy promotes neovascularization. That's the formation of new capillary beds, improving blood flow and tissue repair. It also causes generalized vasoconstriction, which reduces edema and tissue swelling, an important effect for managing inflammatory conditions. Hyperoxia, or hyperoxygenation of blood and tissues, is another key physiologic effect. By increasing oxygen levels, HBO therapy supports cell metabolism and healing processes. Additionally, HBO therapy helps reduce bubbles, which is especially beneficial in decompression sickness or certain vascular conditions. This occurs through Boyle's law, where increased pressure decreases bubble size. In summary, HBO therapy is about leveraging higher oxygen pressures to activate these physiological responses, ultimately supporting recovery, immune function, and tissue repair. Let's take a closer look at comprehensive medical gas therapies and oxygen delivery systems. Starting with the multiplace chamber, this is a large tank designed to hold multiple people, often a dozen or more. It's equipped with airlocks, which are crucial because they allow staff to enter and exit without disturbing the chamber's pressure. This is vital for maintaining a safe and controlled environment. Usually, the chamber is filled with air, but if necessary, only the patient receives supplemental oxygen, which they breathe through a mask or another device. This setup is especially useful for treating multiple patients simultaneously or for certain types of hyperbaric treatments. Now, moving on to the monoplace chamber, this one is much smaller and is designed to hold just a single patient. Interestingly, patients in a monoplace chamber typically don't wear a mask. Instead, the chamber itself can be filled with oxygen, providing a highly concentrated oxygen environment directly around the patient. This makes it a very efficient option for hyperbaric oxygen therapy when only one person needs treatment. Overall, both types of chambers serve important roles in oxygen therapy, offering flexible options depending on the patient's needs and the treatment goals. Let's explore some of the key applications of hyperbaric oxygen therapy in various medical conditions. First, for chronic issues like non-healing wounds, these can stem from long-term health problems, making recovery slow and challenging. Hyperbaric oxygen helps by promoting tissue repair and reducing inflammation, which can significantly improve healing outcomes. Next, in diabetic wounds of the lower extremities, healing is often sluggish and prone to infection. Here, hyperbaric oxygen increases oxygen supply to the tissues, speeding up the healing process and helping prevent complications. Moving to acute conditions, clostridial gangrene, or gas gangrene, is a severe bacterial infection that destroys tissue rapidly. Hyperbaric oxygen works by inhibiting bacterial growth and supporting the body's natural healing response. In cases of carbon monoxide or cyanide poisoning, the danger lies in impaired oxygen delivery to vital organs. Hyperbaric oxygen therapy boosts oxygen levels in the blood, helping to counteract the effects of these poisons quickly and effectively. When it comes to air or gas embolisms, bubbles can form in the bloodstream and block circulation. Hyperbaric oxygen helps dissolve these bubbles and restores normal blood flow, preventing further damage. Finally, for decompression sickness, often seen in divers who ascend too quickly, hyperbaric oxygen alleviates symptoms, by reducing bubble size and promoting recovery. Overall, these applications highlight how hyperbaric oxygen therapy is a versatile tool that supports healing and life-saving interventions across a wide range of medical conditions. Now, let's discuss some of the complications and hazards associated with hyperbaric oxygen therapy, or HBO. While the benefits of HBO can be quite significant, it's equally important to be aware of the potential risks involved. One major concern is oxygen toxicity, which occurs when tissues are exposed to high levels of oxygen for extended periods. This can lead to symptoms like seizures or lung issues if not properly managed. Another risk is alveolar overdistension, which can sometimes cause a pneumothorax or collapsed lung. This happens when the lungs are overly stretched during therapy. We also need to consider the possibility of tympanic membrane rupture. That's a tear in the eardrum, due to pressure changes within the chamber. Ear or sinus trauma is another concern, as the pressure changes can cause discomfort or injury in these areas. Fire hazard is also a critical point to keep in mind, since oxygen is highly flammable, and any spark could be dangerous in this environment. Lastly, some patients might experience claustrophobia, feeling anxious or trapped within the hyperbaric chamber. Understanding these risks helps us balance the benefits of HBO with the necessary precautions to ensure patient safety. Let's take a closer look at nitric oxide therapy, which is a key part of comprehensive medical gas therapies and oxygen delivery systems. Nitric oxide, or INO, was approved by the U.S. Food and Drug Administration back in December 1999. Its primary purpose is to act as a selective pulmonary vasodilator, meaning it helps relax and open up blood vessels in the lungs to improve oxygenation. This therapy is especially important in infants. It's indicated for term or near-term infants who are suffering from hypoxemic respiratory failure and persistent pulmonary hypertension, commonly known as PPHN. In these cases, the lungs are constricted and blood flow is restricted, making oxygen delivery difficult. Nitric oxide helps by dilating those blood vessels, reducing pulmonary hypertension, and improving oxygen transfer. Now, in adults, studies have shown that inhaled nitric oxide can also be effective, particularly in cases where pulmonary hypertension is associated with acute respiratory distress syndrome, or ARDS. So, while its primary use is in infants, we see that nitric oxide therapy has broader applications when it comes to managing pulmonary hypertension across different age groups. Overall, nitric oxide therapy represents a targeted approach, helping to improve lung blood flow and oxygenation, which ties into the larger theme of optimizing respiratory support with advanced medical gases. Let's talk about nitric oxide therapy and its role in medical gas treatments. The recommended starting dose is typically 20 parts per million, which helps ensure safety and effectiveness when initiating therapy. One of the key benefits of nitric oxide is that it decreases pulmonary resistance, meaning it reduces the resistance in the blood vessels within the lungs. This helps improve breathing by making it easier for blood to flow through the lungs. Additionally, nitric oxide reduces shunting, which is when blood bypasses the oxygenation process in the lungs. By minimizing this, more blood gets properly oxygenated, leading to better overall oxygen levels in the blood. It also enhances blood flow to the ventilated alveoli, the tiny air sacs where gas exchange occurs, ensuring that oxygen delivery is more efficient. Overall, the therapeutic benefits are significant. It improves blood flow to the alveoli that are ventilated, reduces shunting, and enhances oxygenation. It also decreases pulmonary vascular resistance, making it easier for the heart to pump blood through the lungs. This combination of effects can be crucial in managing conditions that involve pulmonary hypertension or compromised oxygenation, fitting into the broader theme of optimizing respiratory function through targeted gas therapies. Let's take a closer look at comprehensive medical gas therapies and oxygen delivery systems, focusing on helium oxygen therapy. When administering nebulized Heliox, it's important to increase the flow rate to about 10 to 12 liters per minute. This higher flow ensures that the nebulizer works effectively and delivers the therapy properly. As for delivery methods, Heliox is typically administered through a tight-fitting, non-rebreathing mask with high flow, or through a closed system, such as a cuffed tracheal airway connected to a ventilator. This helps maximize the efficiency and safety of the therapy. Heliox itself is available in two common mixtures, 80, 20 and 70, 30 ratios of helium to oxygen. The choice depends on the clinical need and the patient's condition. One of the key benefits of Heliox is its ability to reduce the work of breathing, especially in patients with airway obstruction. Because helium has a much lower density than oxygen or air, it decreases airway resistance, making breathing easier. This low density is really the core advantage of Heliox. It facilitates airflow because of its physical properties, which can be especially helpful in cases of airway narrowing or obstruction. Overall, understanding these delivery methods and the physical properties of Heliox helps us optimize therapy and improve patient outcomes. Now, let's look at comprehensive medical gas therapies and oxygen delivery systems, focusing on helium-oxygen therapy. When administering helium-oxygen through nebulization, it's important to increase the flow to about 10 to 12 liters per minute. This higher flow is necessary to adequately power the nebulizer and ensure proper delivery. As for delivery methods, helium-oxygen mixtures are typically given via a tight-fitting, non-rebreathing mask with high flow or through a closed system, such as a cuffed tracheal airway connected to a ventilator. This helps maximize the efficiency and safety of therapy. Heliox, the helium-oxygen mixture, is available in two common ratios, 80, 20 and 70, 30. The choice depends on the clinical situation and desired therapeutic effect. One of the key benefits of Heliox is its ability to reduce the work of breathing, especially for patients experiencing airway obstruction. Because helium is less dense than air, it flows more easily through narrowed airways, easing respiratory effort. This low density is really the main advantage of Heliox. Its effectiveness is primarily based on this physical property, which helps improve airflow and reduce resistance during breathing. In summary, Heliox therapy can be a valuable tool for managing airway obstruction, making breathing easier and more efficient for our patients.